Today's video is on a very important topic. The topic is fibroids, uterine fibroids. It's a word everybody knows, but people don't know much about it. So I'll have this video in two segments. The first segment will be on fibroid, the symptoms, the presentation, and the second segment will be on management of fibroids. So for now, this first video will be on fibroids. Let's start by defining fibroids. Fibroids are lumps that grow in the muscle of the womb of the woman. It's not really an illness, but it's something that happens, and we don't know the exact cause, even though we know certain factors that make it more common. For instance, fibroids are 4 times more common in women who are of darker skin, Africans, and those of African descent, than in white people. That's one. It tends to occur earlier in dark people, and they tend to attain larger sizes compared to white women. The average African woman, by the time she's 50, more than 70% will have experienced fibroids. So it's a very important topic. So let me show you the type of fibroids we have. That we describe fibroid based on its location in the womb. There are the ones that are on the outside. We call them subserous fibroids. There are the ones within the muscle. We call them intramural or interstitial fibroids. There are those that bulge into the womb. We call submucous fibroids. There are ones that have a pedicle or a neck. We call them pedunculated fibroids. There's one from the outside. That's one from the inside. They have a neck that connects them to the tissue of the womb. What symptoms do fibroids present? In most cases, you don't even know you have fibroids. They are noticed incidentally during ultrasound scan. But the good thing is that most fibroids have no symptoms and they do not bother you. The ones that bother you, we'll talk about later. Factors that make fibroids more common are one, like I've already mentioned, the racial factor. If you're a black woman, you're more likely to get fibroids than if you're a Caucasian. If there's history of fibroid in the family, maybe your mother had fibroids or your sister had fibroids, you have more chance of getting fibroids. That's what you call a hereditary predisposition. It doesn't mean you'll have it, but your chances are higher than somebody whose mother has not had fibroids. Those who tend to gain excessive weight are more likely to have fibroids. Women what they call spinsterhood, who don't get pregnant for a long time, or who never got pregnant, they are more likely to have fibroids. Women who start menstruating early in their lives are more likely to have fibroids than those who started late. What makes fibroids to grow are the hormones of the ovary, the estrogen and the progesterone. So if you start menstruating very early, you're already producing those hormones. So a girl of 15 can have fibroids because she's already menstruating. And the earlier she starts menstruating, the more likely the fibroid will develop very early. But most fibroids are small, what you call seedling fibroid, can be like tiny corns on the outside. And if you detected, they mean nothing. They're not causing any symptoms, so you don't have to do anything about them. Some doctors who are not gynecologists get excited when they see fibroid, and they blame it for everything. But in most cases, only about 20% of fibroid require surgery. The other 80%, they don't bother you, and we don't have to worry about them. What are the symptoms of fibroids? The commonest symptom that brings a woman to the hospital is if you suddenly start having heavy menstruation, which you never had before. So the first thing we think about is, oh, do you have fibroids? But not all fibroids cause heavy bleeding. The fibroid on the outside, the subserous one, will not cause heavy bleeding. The one inside the muscle will not cause heavy bleeding. But the one that juts into the womb is the submucous ones, or this one, the pedunculated one inside the womb. These ones might cause heavy bleeding because bleeding is from the shedding of the inner lining of the womb, and anything that is inside the womb will contribute to the bleeding. So we usually do a scan to check. But it doesn't mean that all cases of heavy bleeding are due to fibroids. Because most times, sometimes you can do a scan, you don't see any fibroids. But that's the first thing you do. That's the first symptom. Fibroids can also cause painful menstruation. So those who have painful menstruation, one of the investigations we'll carry out is an ultrasound scan to make sure that they don't have fibroids. Fibroids can equally cause difficulty in passing urine because the womb is wedged between the bladder in the front and the rectum at the back. So they might, depending on the size, might make you either to go and pee all the time or make you have difficulty in peeing. The same thing, you may not be able to pass through because it's pressing on the rectum. Just what happens when a woman is pregnant. When the womb is enlarged, there is no space for the womb. It's pressing on the two structures. The bladder is in front and the rectum is behind. People ask, can fibroid cause infertility? Frankly, it's not a major cause of infertility. Unless you have two fibroids growing very close to the both tubes, which is highly unlikely. But they might cause miscarriages because if you have a fibroid jutting into the womb, it's taking part of the space meant for the pregnancy. So you find that such women will get pregnant, but somewhere in the second or third month, she'll have a miscarriage. Having one miscarriage doesn't mean it's the fibroid. What we tend to do, if you have two miscarriages and you have what you call a submucous fibroid, we begin to wonder, maybe this fibroid is responsible for the miscarriage. On such occasion, we say, okay, maybe we'll remove the fibroid. But just because it's there are women who have such fibroids and are still able to carry a pregnancy through and have a baby. And sometimes, because the fibroids are in the womb, they don't allow the womb to contract properly during labor. And such women, more women with fibroids are more likely to have cesarean section than women who don't have fibroids because the womb does not contract uniformly. A lot of women with fibroids deliver their babies, fine, but there are more of them may not, if they are very large fibroids in different parts of the womb, they don't allow the womb to contract properly. So such a woman might end up having a cesarean section. When the fibroids are large, it's like pregnancy, they press on all the organs. They press on the kidney, then they allow the urine to pass through the kidney, and the urine goes back into the kidney, and what you call hydronephrosis, enlargement of the kidney, which might lead to damage to the kidney. They press on all the organs in the body, and of course, cosmetically, it doesn't look very nice when it's very big. So such ones are the ones that require surgery. So to recap what I had already said, fibroids are lumps that grow in the womb. They are more common in dark people. And the more you stay without being pregnant, the more likely you are to have fibroids. You're more likely to have fibroids if there's a history of fibroid in your family. Those who are overweight are more likely to have fibroids. And these are but most fibroids, the smaller ones, do not cause symptoms. And they can only be detected if an ultrasound is carried out. Maybe for another reason you had an ultrasound, they detect fibroids. They don't require an operation. Fibroid can never be an emergency. So anybody telling you to come and have an operation because you have a tiny fibroid, go and seek a second opinion or a third opinion. No gynecologist will tell you come in tomorrow to have a fibroid. You can stay for days. We usually tell you make up your mind whenever you want. It's never a rush. If you're having heavy bleeding, we can manage it with tablets. So fibroid is not an operation you do in a hurry. It's something you plan and make sure you have the right person doing it. Fibroid has acquired a bad name because a lot of people who are not trained to do it are doing it. They end up having complications. The average trained gynecologist or somebody trained by a gynecologist over several years will be able to do a fibroid operation properly so it doesn't have complications. But unfortunately, it's become an all-comers affair in our part of the world, and everybody is doing fibroids. And because of that, they don't know how to do it. They are not properly trained. It got a bad name. So much so that if a prospective mother-in-law hears that the daughter-in-law is going to have fibroids, she screams. So you cannot marry that woman. That's terrible because there's nothing wrong with fibroids. But seek the right person to do the operation for you. Now, this is the first segment about fibroids. The next segment is management of fibroids. How do we manage fibroids? We deal with fibroids based on the presentation. What we normally say is this. You require an operation if the fibroid has been confirmed to give you symptoms that affect your quality of life. Which means that most fibroids do not require anything. The tiny ones that do not bother you And that makes about 80% of fibroids don't need surgery. But then, if you now start having complaints, you go and see your doctor. There are non-surgical means of dealing with fibroids. There are surgical means. And a qualified gynecologist will sit down and explain to you all the things you need. First of all, he will look at your symptoms and know whether they are being caused by the fibroids or not. Like I said earlier, fibroids hardly cause infertility. They might cause miscarriages. They are wrongly blamed for infertility. A doctor who does not know, who's not a gynecologist, does so many tests and looking at a straw to hold, he sees a tiny fibroid, that's it. No, it has nothing to do with infertility. It's a different topic we'll deal with in one of the videos. So, and you might say, do I have to have an operation for fibroids? No. Are there medical treatment? Yes, there's medical treatment, but only temporary. Like if you block the hormones of the ovary, there are some injections will give you. They block the hormones. You get the injection for 6 months. The fibroids will shrink by 50%. Like if you're trying to get pregnant, you have a small fibroid, you say, look, I don't want to have an operation. I'll give you this injection for 6 months. Then we'll stop. The fibroids will have shrunk. You will be able to have your baby, but after 6 months, it will grow back. So you have these temporary methods. You can, as a tablet, you take regularly, like the daily pill for 30 days for about 3-4 months or 6 months to allow the fibroid to shrink if it's not big, to allow you to achieve a purpose. Ultimately, you'll have to do something about the fibroid. So the medical treatment, the tablets, and the injections are just temporary. The other method we call non-surgical, what you call UAE, uterine artery embolization. The womb is supplied by 2 main arteries coming from both sides of the womb. So if you can identify this actually is done by radiologists, not by gynecologists, but they inject something to block the vessels. So the vessels supplying the womb, the main vessels are blocked because the womb still gets supply from other side, from the ovarian vessel, from other vessels. So the womb will not, the muscles of the womb will not die, but fibroids derive their blood supply from the uterine vessels. So if you block the uterine vessels, gradually within 6 weeks, the fibroids will just die and go. But this method is not ideal for somebody trying to get pregnant because it might damage the wall of the womb and make it difficult for you to get pregnant. So it's called UAE. It takes half an hour to do, and it's done by a radiologist, not by a gynecologist. We identify the fibroid, we take you to the, what you call it, interventionist radiologist. They inject something in it, which will, within a matter of days, block your womb. Something you do and go home the same day. That's another method of removing the fibroids. That's the third method we call the high intensity ultrasound treatment, where you use high rays of ultrasound and shine them on the fibroids. It makes them to shrink. Again, this is another good method. It's a bit expensive. It's available in Nigeria. There's a place in Abuja and Lagos. It's expensive, but it can be done. It's available now in this country that you can use the ultrasound treatment. Then the surgical treatment are in so many ways. That's what you call using the microsurgical technique, where you put tiny telescopes and then dissolve the fibroids and suck them out without opening your tummy. And again, within 2 days, you go home. And then you have the main operation called abdominal myomectomy, where you open the womb, remove the fibroids, and then close all the holes where the fibroids have been removed from. The problems arise. Removing the fibroids is the easiest part of the operation but each time you remove the fibroid, you create a hole, what you call a dead space. And if you don't close them properly, when you close the womb, the woman starts bleeding into those openings, and you wouldn't know from outside that the woman, there's no blood coming on the outside, but the blood is draining from the body and filling up those holes. And the more holes you make on the body of the womb during the operation, the more sites where the blood will go. So a woman can die overnight without seeing any blood outside because you did not close the dead spaces properly. And that's what gives the fibroid a bad name. Because only a gynecologist or somebody trained by a gynecologist will know how to close the dead spaces very well. When we're doing an operation, we put a tourniquet to cut out the blood supply. When you now finish, you think you finished, remove the tourniquet and see if blood is coming out from those places. And if blood is coming out from those dead spaces, go back and close them properly. That's why fibroids got a bad name. And lastly, you can do what you call abdominal hysterectomy, where you remove the womb together with the fibroid. You can do this in a woman who maybe in her 40s, who has stopped having children, has no prospect of having children anymore, because the job of the womb is only to carry a pregnancy. So if a woman says, look, I don't want any more children, there's no point going to remove fibroids in a woman in her late 40s and leave her with a womb, because cancer of the womb tends to occur after menopause more often. So you're leaving her, you're solving a problem and leaving her with prospects of another more serious problem. So the ideal situation is if it's a woman who has had enough children and you don't need the womb except to have children. So you can now kill two birds with one stone. You remove the womb, which might likely have cancer 10, 20 years down the line, together with the fibroids. You leave her with the vagina, sexual function is retained. You don't need the womb for anything else. So, but you don't do a hysterectomy in a woman who's not had a child, who has prospects. She might do IVF at 50 or 60. In that case, you can remove the fibroid and leave the womb for her. But if a woman says, look, I've had enough children, then it would be scandalous to remove the fibroids and leave her with the womb. Our job is to educate the woman, explain to her that this is what you need, and they'll get to understand. So to recap, the management of fibroids consists of the medical management, injections to shrink the womb, or tablets for temporarily for 6 months, allow you to have a baby or do something you want. That's one. Two, the laparoscopic method where you use keyhole surgery to sort of dissolve the fibroids and suck them out without opening the abdomen. Then you have the using ultrasound to shrink the fibroids and they will die. The uterine artery embolization, popularly called UAE, which you cut off the blood supply. The myomectomy, where you remove the fibroids, and the total abdominal hysterectomy, where you remove the womb. You can do the hysterectomy either through the abdomen or what you call transvaginal. You can go through the vagina, remove the womb without any scar in the tummy. But that's a major surgery. Two of them are major surgeries: transabdominal, the total abdominal hysterectomy, and vaginal hysterectomy. You can remove the fibroids together. Thank you. If you like the video, please leave your comments and I'll try to answer your questions or reply to your comments before the next video. Thank you very much.